as a brain doctor who has seen far too many lives shattered in a single instant, I am begging you to pay attention. You may think the small changes in your body are just aging, a little weakness in your arm, a moment of slurred words, a dizzy spell that passes after you sit down. But the truth is, these small whispers may be the hidden warnings of a stroke. And when ignored, they can explode into a catastrophe that robs you of your independence, your memory, and your future. Stroke is not always sudden like the movies show. It does not always come with dramatic collapse or unconsciousness. For many seniors, it begins quietly, with subtle signals that can easily be mistaken for fatigue, stress, or dehydration. But inside your brain, blood vessels may already be blocked or bleeding, starving your cells of oxygen. In minutes, those cells can die. Once they die, they never return. That is why recognizing and acting on these warnings is the difference between recovery and lifelong disability. In this video, I will reveal the 5 hidden warning signs that often appear before a major stroke. These are not symptoms you should ignore or explain away. They are urgent alarms that your brain is in danger. If you notice them in yourself or in a loved one, do not wait. Do not hope they will pass. Seek emergency help immediately. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. The first hidden warning sign many seniors overlook is sudden numbness or weakness, often affecting only one side of the body. You may wake up and feel that your arm is heavy, that your leg drags slightly, or that your fingers do not grip the way they should. It can happen in seconds, and it can disappear just as quickly, leading many people to shrug it off as fatigue or a poor night's sleep. But this is one of the most critical red flags that blood flow to part of your brain has been disrupted. When an artery in the brain becomes blocked by a clot or narrowed by years of plaque buildup, the cells that control movement and sensation begin to starve. Without oxygen, the brain cannot send proper signals to your muscles. That is why you may suddenly lose the ability to lift your arm, why your smile becomes crooked, or why one leg feels weaker than the other, even if it lasts for only minutes. This is not something to ignore. It could be what doctors call a transient ischemic attack, or mini stroke. These are brief episodes where the clot clears itself, restoring blood flow temporarily. But make no mistake, a mini stroke is a loud warning that a full stroke may follow within hours or days. Studies show that nearly 1 in 3 seniors who suffer a transient ischemic attack will go on to experience a major stroke within the next 90 days. If no treatment is given, I remember treating a 70-year-old woman who came to the hospital after she suddenly lost strength in her right arm while stirring soup. She thought it was just a pinched nerve, but her daughter insisted she come in. The scans revealed a clot blocking blood flow to the left side of her brain. Because she came quickly, we were able to treat her with medication that dissolved the clot. She walked out of the hospital days later without permanent disability. Had she waited, she likely would have lost the ability to use her arm and leg permanently. Seniors often dismiss weakness as arthritis or old age. But weakness that comes on suddenly is different. It is abrupt, noticeable, and one-sided. The key word is sudden. If your body feels heavy on just one side, if your arm drifts downward when you try to hold it up, or if your smile looks uneven, do not ignore it. This is your brain begging for help. The safe choice is always to call emergency services immediately. Because when it comes to stroke, minutes mean muscles, speech, and memory. Every second matters. The second hidden warning sign is slurred or confused speech. Many seniors notice their words come out jumbled, or they cannot find the right phrase, or they suddenly do not understand what others are saying. These moments are often brushed off as tiredness, stress, or even a joke. But they can be the earliest signs that blood flow to the language centers of your brain is disrupted. The brain controls speech in very specific regions. When a clot or bleed affects those regions, the signals that allow you to form words and sentences become scrambled. You may know exactly what you want to say, but the words come out garbled. Or you may hear someone talking but cannot process their meaning. Families often think their loved one is joking or playing around when words suddenly become slurred. I recall a patient whose husband noticed she suddenly asked for the glass elephant instead of a glass of water. Moments later, she could not answer simple questions. This was not confusion from age. It was a mini stroke. Quick action saved her from permanent speech loss. Research from the American Stroke Association shows that speech difficulties are present in more than 70% of ischemic strokes. It is one of the most common and telling signs. Yet too often, people laugh it off or wait for it to pass. Waiting is the most dangerous thing you can do. If your speech suddenly slurs, if you cannot repeat a simple sentence, or if you do not understand words that should be familiar, this is not fatigue or distraction. This is your brain crying for oxygen. Call emergency services immediately. Treatment given in the first few hours can reverse the damage, restore your speech, and protect your future. Ignoring it could mean losing the ability to speak forever. The third warning sign many seniors ignore is sudden, blurred, or double vision. Vision problems can occur when a stroke affects the part of the brain that processes sight or the blood vessels that supply the eyes. Seniors often think their glasses need adjusting, that they are tired, or that the room is too bright. But when vision changes happen suddenly, it can mean a blood vessel is blocked or bleeding. You may notice half your field of vision is missing, that objects look doubled, or that everything suddenly goes blurry, like a curtain falling over your eyes. I once treated a 68-year-old man who was reading his newspaper when the words on the right side of the page suddenly vanished. He thought it was eye strain, but within an hour, he collapsed with a major stroke. Quick recognition of vision changes could have brought him to the hospital sooner and prevented permanent blindness on one side. Studies published in neurology journals show that up to 20% of strokes begin with vision symptoms. These include blurred vision, partial vision loss, or sudden difficulty focusing. Unlike gradual changes from cataracts or glaucoma, stroke-related vision loss is abrupt. It may last minutes or hours, then disappear, tricking seniors into thinking it was nothing. But this is exactly the time to act. If you ever notice sudden double vision, sudden blindness in one eye, or a shadow creeping into your sight, seek medical help immediately. These are not harmless changes. They are signs that blood is not reaching vital parts of your brain. The tragedy is that vision problems are often dismissed, and by the time the stroke is recognized, it is too late to reverse the damage. Protect your eyes. Protect your brain. The fourth hidden warning sign is dizziness and sudden loss of balance. Seniors frequently feel lightheaded when standing up quickly, and they assume it is normal. But true stroke-related dizziness comes on suddenly and can be severe, often accompanied by nausea, vomiting, or the inability to walk straight. The brainstem, which controls coordination and balance, is especially vulnerable to strokes. When blood supply is cut off here, your body can no longer orient itself properly. You may stagger as if drunk, lean to one side, or be unable to stand without support. I treated a woman in her 70s who suddenly felt the room spinning while cooking. She vomited and could not walk across the kitchen without stumbling. Her family thought it was vertigo. Hours later, she was diagnosed with a cerebellar stroke. Quick treatment reduced the damage, but she still struggles with balance years later. Medical studies show that balance and coordination problems are present in nearly half of all strokes that affect the back of the brain. The danger is that these are often misdiagnosed as inner ear issues or dismissed as simple dizziness. But when dizziness is sudden, severe, and combined with other symptoms like slurred speech or vision loss, it is a red flag. If you suddenly cannot walk in a straight line, if you feel like the room is spinning violently, or if you lose coordination without warning, call for emergency help. Do not wait to see if it passes. This could be the beginning of a devastating stroke that affects not only your ability to walk, but also your ability to breathe and swallow. Balance is life. Protect it by acting fast. The fifth and often most dramatic hidden warning sign is a sudden severe headache, especially when it feels different from any headache you have ever experienced. Seniors may think it is just stress, dehydration, or sinus pressure, but a thunderclap headache, one that appears instantly and with great intensity, can signal a hemorrhagic stroke. When a blood vessel in the brain ruptures, blood spills into the surrounding tissue, increasing pressure inside the skull. This pressure causes severe pain, often described as the worst headache of one's life. It may be accompanied by vomiting, dizziness, blurred vision, or loss of consciousness. I recall a patient who was watching television when she suddenly clutched her head and screamed in pain. Minutes later, she collapsed. She had suffered a massive hemorrhagic stroke from an undiagnosed aneurysm. Headaches linked to stroke are not mild. They are explosive, sudden, and overwhelming. Research shows that severe headache is present in up to 1/3 of hemorrhagic strokes, especially in younger seniors and women. The tragedy is that many dismiss these headaches as migraines or fatigue. If you ever experience a sudden headache that is unlike any you have had before, seek emergency care immediately. Do not take painkillers and wait. Every minute lost allows more blood to damage your brain. Acting quickly could mean the difference between survival and death. Despite the seriousness of these warnings, many seniors ignore them. Why? Because the symptoms can be fleeting, subtle, and easy to explain away. Weakness is blamed on arthritis. Slurred speech is blamed on fatigue. Vision problems are blamed on poor lighting. Dizziness is blamed on low blood sugar. Headaches are blamed on stress. Seniors often fear being a burden, so they downplay their symptoms. Families may hesitate to call for help, thinking it will pass. But this hesitation is deadly. Studies show that nearly half of stroke patients delay seeking care because they believe their symptoms are not serious. By the time they arrive at the hospital, the treatment window has closed. I have seen too many patients arrive hours too late, when clot-busting drugs or surgery could no longer help. Education is the key. Seniors and their caregivers must know that stroke symptoms are sudden, unusual, and urgent. The acronym FAST is a life-saving tool: face drooping, arm weakness, speech difficulty, time to call emergency services, even if symptoms disappear in minutes. As with a transient ischemic attack, the risk of a full stroke in the next hours is high. Every suspected stroke deserves emergency care. Ignoring the signs is like ignoring smoke in your house. The fire may not be visible yet, but it is already burning. Seniors must learn to trust their instincts and act fast. Caregivers must encourage, not dismiss. The greatest tragedy is not the stroke itself, but the knowledge that it could have been prevented with quicker action. Doctor's final words. The hidden warning signs of stroke are not random accidents. They are your body's urgent messages that blood is not reaching your brain. Sudden weakness, slurred speech, blurred vision, dizziness, and severe headache are not normal parts of aging. They are alarms. Ignoring them can cost you your independence, your memory, even your life. But there is hope. When recognized quickly, strokes can often be treated, damage can be minimized, and lives can be saved. The key is awareness and action. Do not wait. Do not dismiss. Call for emergency help the moment you notice a symptom. Your brain cannot wait. Every second matters. Remember, prevention is power. Learn the signs. Teach them to your family. And never be afraid to act. Because the difference between walking out of the hospital and never walking again can come down to those first few minutes. Share this video with someone you love. You may save their life. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned today that you will apply in your own life. If you enjoyed this video, comment 1. If not, comment 0. And do not forget to like, share, and subscribe for more senior health tips. Your best years are still ahead, if you choose to protect them.